Speaking today is Randy Bauernschub, the Vice President of Customer Solutions at BHS. Turning over to you, Randy.
Thank you, Heather. And thank you to Corporate Synergies for hosting this very important topic today. And of course, to all of our guests for joining in today's discussion as we discuss the impact of mental health in the workplace. I think that if you're joining today, you probably realize that mental health in the workplace is not a new topic in the United States or for employers across our country. But I will say that there is a new twist to it given the outbreak of the recent coronavirus. Like many things over the last 2 months, COVID has forced us to not be together today and rather have this talk over a computer screen. But I still hope that the result will be the same for all of you, in that you will take away some ideas, some tips and tricks for mitigating the risks that are associated with unaddressed mental health issues in your workplace, especially during the COVID crisis. So the truth is that the United States was already facing a serious mental health crisis prior to COVID. In fact, EAPs have been providing work-based programs for actually 70 years. And that's really a whole different presentation in and of itself when you look at the EAP industry and how EAPs address mental health in the workplace. But it seems like we've come full circle on that as BHS was just starting to see an uptick in employers reaching out for more comprehensive and more holistic programs and strategies for addressing the mental health issues that they were experiencing in their workplaces. It's a concern. Suicide rates and opioid use and violence and mass shootings, the rates have never been higher. And this is all pre-COVID. When we think about some of the prevalence data, we know that about 20% of US adults are dealing with a mental illness in any given year. So it is important that we are, considering some of these statistics. 1 in 9 Americans are using an illicit drug at any given time. Almost 20 million dealing with a substance abuse issue, and of course suicide at a rate of 4.3. And that is all while there is a serious shortage of mental health providers available to help people with these issues. They're just not available to take appointments, or they're not taking insurance, and we're finding that individual workers are left feeling very frustrated by the fact that they can't receive access to the right level of care to deal with some of these issues. BHS was collecting its own data through March and April into our contact center and looking at call volume and areas where the need was increased. And of course, anxiety and both work and personal stress were the top areas. Not surprising, but we still need to address it. So when we bring the data sort of out of the United States as a country and into the workplace, we really have to say right now that during COVID, there is no one who is unaffected in some area of mental health. So pre-COVID, we knew that 60% of employees were experiencing at least one symptom of a mental health condition in the last year. 50% of those workers were saying that that those symptoms were lasting for longer than 1 month. So when we think about something, oh, I'm just having a bad day, or I feel sad this week, it's really bigger than that. When things start to persist for longer than 1 month, there have to be interventions and resources available to address those things. Yet, we know that only 25% of workers ever receive any kind of formal diagnosis or any kind of treatment. A survey that was conducted in the last month due to COVID said that 7 in 10 employees indicated that the pandemic is the most stressful time of their entire professional career. I think that we're seeing that and feeling that every day as employers and employees. So when we drill that down and we take a look at how does that impact the average employer, BHS used some calculators and we used some studies that had us look at an employer group with approximately 500 employees in the state of New Jersey. And sort of drilling down on those statistics and pulling out these 4 data points on burnout, depression, substance abuse, and thoughts of suicide specifically. I mean, there are many, many more mental health issues and behavioral risks in the workplace besides these 4. But in looking at these, an organization of 500 employees can say to themselves, wow, I really can't ignore this. And even though I know my organization is under financial pressure right now, mental health has to be a priority. So we look at these and we say, okay, in normal circumstances, burnout would be a problem, or depression, or substance abuse, or suicide. But with COVID, the uptick and the increase in these data points, going from burnout 61% in February to 74% in April, that's a big number for an employer with 500 employees. Depression is rising due to isolation and loneliness. Substance abuse, we know that anxiety is a trigger for underlying substance abuse issues and really any underlying mental health conditions. And that's why we're seeing these numbers 3 times, 4 times what they would normally be this time. Suicide, that's a seasonal thing. We always see an uptick in suicide in the spring season and the fall. A lot of times people think it's around the holidays when it's cold and, people are sad because they don't have their loved ones or whatever their circumstances, but really April and May are the highest months for suicide, and then again in the fall. So although we're not seeing an increase in actual suicides right now, according to NAMI, we are seeing that the symptoms are worse, which means it'll have a prolonged effect. And we are seeing, some circumstances of that. I mean, there was an emergency room doctor at New York Presbyterian, who died by suicide, underlying conditions, and COVID is just becoming a trigger for those types of things. The burnout is bad right now, and where burnout used to be related to workload or maybe inefficient or insufficient rewards from an employer, or even lack of control over someone's work, now what we're seeing with burnout is that it's the separation between life and work because everybody is remote, working from home, having their family and their children responsibilities. So when people talk about burnout now, it is from that perspective that they're talking about burnout, which is why that uptick from 61% to 74% in the month of April. So it's definitely going to have an impact on business. Pre-COVID, we knew that 61% reported that productivity at work was affected by their mental health status. And people really have to understand what mental health is. It's a state of being. Everybody has mental health. You're just, at any given time, you're just either in good mental health or poor mental health, depending on the things that influence your life. It's just like regular physical health. Somebody says, oh, I can't believe that person died of a heart attack. He was in such good health. It's the same thing for mental health. And there really has to be, you have to look at those things side by side. Over 1/3 thought that work contributed to their mental health symptoms. Nearly 2/3 of our workers missed work days because of a mental health condition. 1 in 5 left their jobs voluntarily due to mental health. And we know today in our recruitment and our talent, acquisition, that 86% of job seekers, certainly the Gen Zs and the millennials, expect that the company provides mental health services, programs, support. It's an expectation that, and it's not so much even a stigma thing for that age demographic, because it is an expectation. Where do I sign up? How do I get access to my therapist? According to a study, 62% of employees noted that they've been losing 1 to 2 hours a day in productivity given the current circumstances. So again, these statistics that we've always been watching are now just heightened due to the current environment. So that also has a financial impact. You know, all of these statistics mean something in dollars and cents. And it really comes down to how the organization or the business is going to feel it financially. So we know that the number of work days, 217 million work days were missed or lost due to a mental illness. Over $210 billion spent on depression. And the interesting thing about that is that we know that half of that cost is attributed to things that are happening in the workplace related to depression. So this is not necessarily direct medical cost or medical spend as it relates to depression. It's workplace stuff, productivity, absenteeism, presenteeism, that's accounting for half of that statistic. Substance abuse, the impact of substance abuse financially. I mean, there's a show on Netflix. I know everybody's watching a lot of Netflix right now, and there is a series right now called How to Fix a Drug Scandal. It is about a drug lab chemist in the state of Massachusetts who created a lot of risk and a lot of cost for her employer, in addition to the lives that, you know, she may have ruined with the defendants. But there was an underlying mental health condition that this employee was struggling with, and she had some depression. And as soon as she took that job in Amherst at that lab in Massachusetts, she started tampering with evidence, using the drugs that she herself was responsible for testing the authenticity of, and she became addicted. And it went on. The worst part of it is, when you talk about business impact and financial impact, is that it went on unaddressed for 9 to 10 years. It's a good one on Netflix if you haven't seen it. And then, of course, the cost of replacing an employee. You know, I have a personal story with this right now. My husband, I'm in Bucks County, Pennsylvania. My husband is a small business owner, and he had an employee die over the weekend due to a relapse because of COVID triggering a relapse. There are situations where employees are dying or just turnover because of performance or whatever, but the cost in replacing employees is 90 to 200% of that person's salary. And when you're a small business, that can be really damaging. So I know that's like a really kind of doom and gloom way to start our talk today, and I'm sorry about that, but it is the reality. But it's not all negative. There are a lot of positive things happening, and there are a lot of positive things that employers can do to improve the impact of mental health in the workplace. And I want to sort of switch gears a little bit to focus on some of that, you know, so that we're kind of getting some uplifting information here. So what can we be doing? Well, I think the most important thing for employers to realize, which they actually were over the last 9 to 18 months starting to realize, hey, we really need to have a mental health strategy in the workplace. It's not enough to just say we have a program or we have resources. There really needs to be some kind of strategic approach to mental health so that the organization, you know, can perform at the highest level. And it can only do that if it's aware of the behavioral risks, if it's mitigating those risks and supporting its employees so that they can achieve their fullest potential, bring their best selves to work each day so that the company can thrive. And this is a mission that the company that I work for, BHS, we adhere to this same thing. We believe that there is a formula to it, and that with the right strategy in place, businesses can still thrive pre-COVID, during COVID, and post-COVID. And it works when there's a focused CEO who can lead the charge, The senior leadership team is motivated. Therefore, employees are engaged and energized, which then creates the result of happy and loyal customers. And that formula sort of works, forward and back to help companies thrive so that they can meet their growth strategy and their business goals, and at the same time create a workforce and a culture that is allowing people to be their best every day. It's sort of the organization needs the employees, and if there were no organization, those employees would have nowhere to report each day. So it all works together, but it's an important formula. And when you're sitting down and doing some strategic planning or consultation around, well, what does a mental health strategy look like? Consider some of these people and culture tactics. So we talk about behavioral risk. I don't know that that's really common terminology in the marketplace right now, but it is for us in the conversations that we're having. So behavioral risk, it starts with being able to identify what those behavioral risks are. When we say behavioral risk, we mean the risky behaviors that employees bring into the workplace each day when they show up. So it can be anything from workplace violence to drug and opioid use, anxiety, stress, and burnout, certainly depression and suicide, but even harassment and bullying, disruptive personalities, that all creates a toxic culture, and even domestic violence, which we're seeing a major uptick in right now due to COVID. So first, know what the risks are and be able to identify them. Once you've done that, associate a cost to your business back to that behavioral risk. You have to really understand the cost that is associated with each one of those. And then once you've done that, you need to start to implement strategies to mitigate the risk and reduce the financial loss. And there's really no roadmap right now with COVID. So it's really just thinking about the right strategies and the right solutions to have in place now and as we move forward and return back to work. I mean, we know that it's a very common statistic that adults spend 1/3 of their lives at work. So the workplace has to address this, and it can't be ignored. So looking at some of these workplace strategies and solutions, we've outlined these strategies here so that you can think about them from sort of, what are you doing today? Are you doing something? Are you doing nothing? Do you feel like you could be doing more? And that's really how you want to approach the question of, what are we doing as an employer? And you can sort of line that up from things that are low to no cost, and then you move across the continuum to things that are a larger investment for an employer to make. And that's how we've lined them up here for you today. Something like peer support groups, or having a care coordination program or service, all the way up to bringing somebody on site when we're allowed to for coaching and counseling, or a full comprehensive behavioral risk management solution. And there are a lot of things you can do under each one of these categories. And so we'll drill down on each of them a little bit right now. So the first solution, or the first strategy you might consider implementing, is just simple peer support groups. Small groups who have volunteered and been trained a little bit to provide support, active listening, a compassionate ear, and just empathy towards coworkers. This can be designed to support staff who are in crisis, and that crisis can be work-related or personal, but it can just be ongoing groups, just ongoing support groups. This team of people can also serve as your promoters. If you have an employee assistance program in place and you offer that, to your employees, this team, this peer support group can be promoters, of that service, really understand what's available through the EAP and help people get the support they need. It always must be backed up by mental health professionals. So whoever is serving in a volunteer role in that support group must have some clinical backup or some mental health backup that they can refer to when something comes out in the peer support group that, requires something more than just, are you okay, or a compassionate ear. So some of the key ingredients in putting peer support groups together are that they have to be built on the foundation of a social group. And that's really all it is. It should really help reduce stigma because it's just a gathering of like-minded people who have experienced perhaps the same things and know how to cope and navigate through that and can share that knowledge with the rest of the group. It's built on a foundation of trust. In order to have any kind of open and healthy dialogue, there must be trust. It has to be completely confidential, and there has to be easy access to the peer support group. These are best practices for what makes peer support an effective strategy in the workplace. Now, if the workplace doesn't feel like the right solution, there are many online support groups that are popping up all over the place because of COVID. And it really helps decrease that sense of isolation and the stigmatization that goes along with mental health. And I will say this, as people consider going back to work, returning to work, whatever is going to become your new normal in your workplace, this peer support groups are probably a good first step in reconnecting everybody, coworkers, as they return to work. So something you might want to consider, not to mention the fact that it's good for morale and overall culture as it provides an emotionally safe workplace for people to return to. So solution number 2, we call care coordination. Another term that sort of gets thrown out a little bit and misunderstood. So having care coordination as a resource in your workplace for your employees is essential in that it serves as a single point of entry for all things mental health and behavioral health. It also helps reduce stigma because oftentimes employees are willing to talk to a care coordinator instead of my therapist or my counselor. It just feels softer and better to talk to the care coordinator. So what is a care coordinator? Well, with a really comprehensive focus on this, a care coordinator should be a master's level clinician. And if you're providing a care coordination program to your employees, they will have access to this team of care coordinators, this team of master's level clinicians. Notice that I didn't say licensed counselor because I'm going to get to that, but it's not necessary at this level. Master's level clinicians who can do intake and assessment and peel back the layers of the onion to look at any underlying mental health issues, provide crisis counseling, in-the-moment support, they should have those credentials and that type of expertise and background, but not necessarily licensed counselor at this stage in the game. What they should do is be dedicated to each person who calls in to access service. That care coordinator should become dedicated to that participant for the life of their journey. And they become their personal advocate and, quite frankly, oftentimes their friend because there's a rapport that's built there. That care coordinator is going to help that individual get connected to all of the resources, support services, programs, benefits, whatever they need for whatever they're struggling with. And that care coordinator is not just going to say, here's a list, it's lots of resources on here, here you go. They're going to actually make phone calls, send emails, schedule appointments on behalf of your employee because they're already dealing with the stress and, possibly frustration of services that they've tried to access previously. That same care coordinator is going to be available to your employee on an unlimited basis, on demand, for in-the-moment support in between appointments or whenever your employee might need the support of that care coordinator. And then really importantly is 100% follow-up. So making sure that that care coordinator follows up with that person all along the way to make sure that nothing is slipping through the cracks, to make sure that they're connected to care, that they're getting the help they need, that they're a right fit with their counselor, if that's what the recommendation was. So a really, really important process when you think about sort of the concierge style, high touch level of this care coordination program. So care coordination is the second solution. The third recommendation for solutions that you can implement is an on-site counselor or an on-site coach. Now, you'll have to have, green light in whatever, be in the right phase, or green light wherever you live to be coming back to work and getting people gathered together again to put an on-site counselor or an on-site coach in place. But this is no longer, even pre-COVID, this is no longer considered an optional perk. It really sends a message to employees that you care about their well-being, that it's valued, and that you're trying to really help with those barriers to care by putting the person right on site in the workplace. You embed them right there for access. It's easy, it's convenient, there's no commute to a counselor or a therapist's office. It's in the moment. And then, of course, if there's ever a critical incident or any kind of disruptive event in the workplace, the counselor or the on-site person is right there to provide immediate crisis response. Best practice for implementing an on-site coach or an on-site counselor is to really work with your communications department to keep employees informed about the privacy and confidentiality measures that wrap around this type of a service, even working with your diversity and inclusion team to accurately represent all of the cultural needs of your workforce. Some of the things that employers think about having an on-site counselor is, well, it's only that one person. And what if that one person isn't the right fit for my 3,000 employees or whatever the case may be? So you just want to bring diversity and inclusion into sort of an integrated implementation of an on-site coach or counselor. And then, of course, you have to consider space issues because they will need a place to conduct peer support groups or one-on-one sessions or any kind of activity they may be doing, which can be any of these things. Oftentimes people think, oh, if I implement an on-site coach or an on-site counselor, they're just going to sit in a room at the end of the hallway and take private one-on-one appointments all day. And they can, if that's what you want them to do, but they can do any of these things. They can provide counselor chats for employees who may be struggling as they, I can talk about this like pre-COVID and post-COVID, and I know that there's probably questions about both, and these things apply no matter what, because like I said, mental health in the workplace was a trending topic and a problem far before COVID struck. So counselor chats for employees, counselor chats for managers. We know that managers sit on the front line and they are the first ones who observe deteriorating job performance or odd, bizarre behavior or risky behavior among their team or throughout the workforce. So having that on-site coach or counselor available to do those counselor chats with managers and supervisors is just as important as the support group and chats for employees themselves. One-on-one sessions, obviously, are something that the counselor or coach can do, but even getting into a more holistic approach, wellness and well-being, mindfulness and meditation, critical incident, disruptive events, the on-site coach or counselor can help with promotion, vendor integration. How do we get employees to maximize all of the employee benefits and programs and resources that are available? Well, that coach or counselor who is on site can become the nucleus and the quarterback for all of those resources. Vendor integration, seminars and trainings, education booths, and meet and greets. I see questions that are coming through, and I promise I am gonna get to the questions at the end. I'm gonna keep rolling through right now, and then we'll have Q&A at the end, but I'm seeing some very thoughtful questions coming through, so thank you. Solution number 4 is what we call behavioral risk management, and this is a very comprehensive strategy and solution, and it involves making sure that there are resources, services, and programs available in all 3 pillars. There tends to be a focus with standard programs or tack-on EAP type programs where it's all focused on the employees and making sure that you have resources and services for the employees. Don't get me wrong, those are invaluable resources and they are necessary because after all, it is the worker, the employee, who we are trying to support and get assistance for. But that alone is not enough. And that's where a lot of programs and EAPs fall short. You have to have these other 2 pillars of support. Supervisors and managers are very important when you talk about, workplace culture, workplace productivity, minimizing behavioral health risks. They need to have access to a team of experts. And those should be management consultants or performance consultants who are dedicated specifically to the managers and supervisors and HR team within your workplace. They should have constant access to those people for consultation, for education materials and advice and guidance, and even to take a referral from a supervisor or manager if a situation gets, a small situation starts to become larger and needs a more complex intervention. And then the organization itself. What I would like to say about employee assistance programs is that 70 years ago in the 1950s, when they were first implemented, they were intended to be work-based programs, really to be thought of as occupational social work. And what's exciting to me today, as we sit here in 2020, is here we are 70 years later, right back at it. Because a good EAP, a real EAP, should approach your partnership through the lens of the business and the organization and what that EAP partner can do to support the organization so that it can meet its business goals and thrive so that everything else can trickle. So innovative workplace solutions, very important component of a behavioral risk management solution. So what is in a behavioral risk management program? Well, whoever you partner with to deliver this type of service should be able to provide policy review and consultation. I know for BHS, customers are calling us, HR points of contact, saying, what should our testing policy be for COVID as employees start to return to work? And what should we do with social distancing? And they're calling our performance consultation team to get that advice and to get help with some workplace policies, making sure that everything is in line for any type of critical incident that may occur. Employee referrals, and then the compliance reporting that goes along with that. Really, really high-level care coordination, management training, on-site coach or counselor, or even an on-site behavioral health consultant. You can call that person whatever you want, and they can have whatever credentials and background you want them to have. And then interventions and awareness campaigns to combat negative trends. That is what behavioral risk management does for an employer. So now that we are moving into the actual tools and resources, I want to just bring up stigma, because I think I would be remiss if we did not talk about The fact that none of these solutions or strategies or programs will be effective unless you address and reduce stigma in the workplace. And it just needs, you just have to talk about it. You know, there just needs to be a culture of accepting it and allowing employees to take the time for self-care. They need to see that. They need to feel that. Most workers are not going to seek help or treatment because of fear of shame. You know, these statistics say it, and this is all pre-COVID. You know, 60% have never talked to someone at work about their own mental health. I imagine they will now post-COVID. I think that's going to get better. Only 48% have positive experiences when talking about their mental health. Less than a third are comfortable talking with their company's HR or senior leaders about it. So this means that decision makers are going to be the least likely to know if there's a true mental health challenge in their workplace. So, but if you can reduce stigma and get people to talk about it, you will know, and then you can address it, and then you can mitigate it. So what are some of these tools that we're talking about? I know that in these uncertain times, how you treat your employees will be remembered for years to come, well beyond COVID. So considering some of these tools and some of these resources, if you don't already have them in place, is a good next step. So again, a care coordination program. Find care coordinators, help employees connect to the right resources. It's not enough to just have an employee assistance program if it's an embedded, tacked on, low touch EAP. You have to have that care coordination. Work-life services. This goes beyond mental health, childcare, elder care, legal, financial. We're seeing it. We're in a major economic downturn. These work-life services need to be wrapped into your mental health strategy. Of course, telehealth and digital behavioral health solutions are having the time of their lives. I mean, they never expected, they were having a real hard time getting people over that hump of having any kind of appointment, not just online therapy, but any kind over, you know, through a telehealth platform. But I think we've finally arrived with that. On-site coaching and counseling, health apps, trainings and videos, having a robust online like resources and resource library, and then integrating any of your wellness and well-being programming into your mental health strategy will give you a real opportunity to address the whole person, and that's what we're trying to achieve. I know that telehealth right now has lifted its restrictions with counselors and therapists being able to provide video counseling across state lines. Normally, you have to be having your video session with a licensed counselor in the state where you live or work. But right now, all of those restrictions are lifted, as well as what we've seen in the insurance industry with Medicare and different lines of care being covered and more flexibility in how care is actually getting paid for. So that's all due to COVID, and we'll sort of see what sticks around afterwards. But at least now that shouldn't be a reason for people not seeking help or getting care. So one thing that is important to talk about is if your primary solution is that you offer an EAP, an employee assistance program, to your workers, you really have to evaluate the difference in the types of EAPs that are available. We have sort of bucketed them into these three categories: embedded EAP, carrier EAP, and standalone. And you'll see across the bottom of the slide that each of those different types of programs will yield a different utilization rate in your organization. So what do we mean by embedded? So a lot of times, these are the box checkers. You know, it comes with some other line of service like short-term disability, or you name the line of coverage, and there's a free tacked on embedded EAP thrown into the package, and now you have EAP. But I assure you, you don't have EAP. So it's really only available sometimes to those people who take that line of coverage, so it doesn't cross the entire workforce and their dependents and family members and household members. And there's really nothing, there's no infrastructure around it. There's no program management. There's no ongoing reporting and trend analysis. There's no ongoing program promotion and organizational support for the business. It's really just a little tack-on employee type benefit. Then there is the carrier model, where this is, coming through the big health insurance carriers, and it's seen like an ancillary employee benefit. Health insurance carriers are not EAP experts. EAP experts went to school for EAP. Many of the employees where I work at BHS went to the University of Maryland School of Social Work, got their degrees in occupational social work with a focus in EAP administration. Those are people who know how to do EAP the way it was intended, which are those 3 pillars I talked about earlier. You will not have customer service. You may have customer service reps answering the phone in a carrier model. Very often, if you do access services through a carrier model, you're going to get a health insurance directory, which has a list of providers. And when you call in and explain what your presenting issue is, you will be handed a directory, and you will have to go off and call those providers yourself and get an appointment and try to access care on your own. And again, these programs are not work-based, so they don't focus on the organization. Standalone means that you're out seeking an EAP partner where this is all they do. It's their focus, it's their priority, it's not a bundled in service, it's what they do every day. And you'll know that you're talking to a standalone EAP if the business and the organization is their focus. It's like organizational performance has to be the core component of their program. It should be very high touch. It should resolve employee issues and workplace issues. It should help you contain costs, talking about that behavioral risk management and mitigating those behavioral risks. It's a true workplace partner and not really so much an ancillary employee benefit. So those are the differences to look out for. And then I'm going to sort of end my talking portion of this before we get to questions with the engagement question. So we've outlined the data, the statistics, the problem, some solutions and interventions, and now how do we achieve and maintain engagement? And when we talk about engagement, we talk about it in 2 ways. There's engagement at work, just in general, and then there's engagement in these mental health programs themselves. So this list here is sort of, recommendations for how to increase engagement in the program, whether the program is EAP or a wellness program or care coordination or telehealth, whatever the program is, how do you increase engagement in that program? And these are some of the ways. Everything starts with really vetting it out and selecting the right partner. And if you're really trying to drill down on those behavioral risks, there has to be care coordination in there. Involving the communication and marketing team at your organization to help spread the word, create stickiness and visibility, positive messaging, reduce stigma. Finding champions and designating roles to people like that peer support concept, training your managers and your supervisors, as well as making sure they have access to clinical professionals like management consultants or performance consultants within your EAP or as a separate program. Launching mental health awareness campaigns. There are national observances, like May is Mental Health Awareness Month. So making sure that you're doing some kind of campaigning, like an awareness campaign with those monthly observances. There's a suicide, there's every month, there's something going on that you can relate back to mental health or behavioral health. Providing a variety of resources. This is not a one-size-fits-all for employees, and considering an on-site an on-site resource to increase engagement. Like I said, when the person is right there in the workplace, it's hard not to engage. So when we've seen programs struggle year after year with participation, utilization, engagement, we will often consider an on-site resource once a week, once a month, once a quarter, and we've got programs where there's a 40-hour-a-week on-site counselor, coach, or consultant. It's just whatever the budget and whatever the preference is. So that takes us to the end of my talk track so that we can have time for questions. And I know that we've been gathering up some questions in the chat feature here. So I'm going to go to the top of them and read them out and see if I can do my best to answer them. The first question I see is, could workers' compensation be part of the financial impact on organizations? 1,000% yes. And when you're consulting with your workplace partner, whoever or whatever that is, you should be talking about, workers' comp as part of your implementation and how to address that. Another thing that comes into play now that we're talking about, sort of financial impact too, is some of our programs have even asked us to get involved in financial hardship programs where they allot a certain amount of money, and when their employees run into hard times or a difficult financial situation, they can tap into that fund, get that money, and your behavioral risk management partner or your EAP can help you with the administration of that. Let's see, the next question says, we're getting a lot of questions around returning to the workplace. How can organizations and leaders support employees as they return to work? So these are great questions, and we are actually getting a lot of those types of questions from our own customers at BHS right now. As everyone is preparing to return to work, they're calling in to our performance consultants and talking to that team of experts about what to do. And our team provides consultation direct to HR about how to prepare for that. They provide tip sheets and policy review recommendations. And some of the things they're saying are, somewhat obvious. I was just looking at a tip sheet that we have here over managing emotions as employees return to work. People, managers and HR and supervisors have to sort of be ready to look for the signs and symptoms that something isn't quite right with their workers, their employees. And, there's a hypervigilance around that. There's going to be some mistrust of coworkers. Coworkers are going to look at their fellow coworkers as a potential point of infection and not just their coworker. So all of these things, all of these attitudes and all of these cues for danger, pacing, do they startle easily? Are they antsy? Are they making sure that they're like 15 feet away? These are things that supervisors and managers are going to want to be tuned into and looking for. Hypochondriacs, there's going to be heightened anxiety. Individuals who may already have underlying anxiety are internalizing these events, and even now in the news, more anxiety as we learn that there could be an impact on children. Before we were sort of like, oh, well, at least it isn't really harming the children 18 years and younger, but now there's new reports out that there may be a link to COVID and these other inflammatory issues. So there's just going to be a lot of heightened anxiety, and supervisors, managers, HR are going to have to be really alert about supporting employees as they come back. I would think that if you have an EAP, they should have plenty of resources available to you for how to communicate with employees, both formally and informally, in small groups, one-on-one, through company-wide communications. I think the most important thing with that is to be honest and use facts. Just acknowledge when you don't have the information, but be factual in all of your communications. I also said frequent updates and easy to understand infographics. So sometimes instead of sending out like a long letter or a multi-page paragraph communication? Is there something that you can do more visually with infographics, even if it's just signs around the workplace for, reminding people, what their new behavior needs to be in the workplace? Okay, so let me move on. Oops, I think I lost my place in the questions here. I think as new ones get added, I get bounced. Okay. Monitoring, the next question is, how can we monitor employee behavior when we are working remotely? So I am a remote worker. I've been working for BHS for 11 years from this office right here. So COVID has not changed, and I manage a team of 12 people. So I'm a remote manager. I have remote workers. It's just really important to have scheduled check-ins. With my team right now, we're doing twice a week. We're doing once every 2 weeks mental well-being checkups, and we're doing twice a week check-ins. It's a status check-in. We're also trying to have fun at work. We're coming on to Zoom, and we're doing scavenger hunts, and we're trying to do things so that we can really keep a pulse on what's going on. We're do surveys. You can survey your remote workforce and put out some pulse surveys right now. You might think like, oh, it's not the time for that. It actually is. The response rate that we're seeing within BHS and across our customer book of business is an 89% response rate on surveys now during COVID. You want to solicit feedback, and people want to give it. Question number 4 is, can an on-site counselor prescribe medications like for depression or other illnesses? So the answer to that is no. Only psychiatrists can prescribe medications like that, or maybe a family practitioner. And it really depends on the credentials of the person that you bring on site. I mean, that is really to your discretion. It can get very costly. When we talk about an on-site coach or an on-site counselor, we're talking about a social worker, a master's level clinician, a performance coach, somebody with that type of background that's really dealing with a lot of subclinical issues in the workplace, but that on-site person has a connection back to your employee assistance program or to the health insurance carrier. So when there is something that's higher risk or more clinical or more complex, they can make that on-site coach or on-site counselor has access to all of those resources and can make that referral over to the appropriate level of care. Question 5, if an organization cannot afford an on-site counselor, are counselors available 24/7 by phone or online? Does this impact the level of care? So that's a good question too. An on-site counselor is not always affordable. And I don't mean an on-site clinic. I just mean a person who comes every Tuesday from 9 until 1, just to be available to support employees. So the cost can be managed based on the credentials and the frequency of the person, but 24/7 is absolutely available. There are many, many resources, namely EAP, that provide 24/7 triage, intake, assessment, and connection to appropriate level of care. In fact, that's what care coordination is. It's a 24/7 service. Okay, number 6, let me see how my time is. Number 6, is the on-site counselor an actual employee of the company or an independent contractor? Not an employee. Support groups can be employees of the company. Your on-site counselor or your coach should be contracted in through an outside vendor, a third party, your EAP, something like that. You would want to contact them and ask how you can get that implemented. Question number 7, how do you keep employees from thinking that if they use the EAP, that it gets reported to the employer when you communicate that it is a confidential service? So programs like EAPs must follow all federal and state privacy and confidentiality laws, or they would be out of business in 2 seconds. I mean, all of those, first of all, there's a notice of privacy policy that gets extended to all of the participants before they engage in services so that they understand if there were ever a situation where the workplace needed to be involved, and it were a referral, a formal or a mandatory referral, that employee would sign a release of information so that the information could be shared, and not the details, just compliance with the action plan. So you can share with employees an actual EAP report and show them that it's just trends, it's just aggregate summary data, like, how many people are calling in for stress, how many people are calling in for relationship and marital issues, grief and loss, and it's just a bar graph that shows the frequency in an aggregate way. So employees should feel very secure in accessing these services, knowing that they adhere to all privacy and confidentiality laws. I don't know if I have time to keep going. I think there's only one more. How do we find dedicated care coordination services? I mean, that is a service that BHS provides, so we're happy to consult around that. But they are important in access to care and connection to resources. So corporate synergies can inform you about any of those types of resources. And that's it for my time, Heather.
Thank you, Randy. Excellent information on the impact strategies and resources for improving mental health.